Press the bell icon on YouTube and don't miss another update.
I am Dr. Shishir Bhatnagar. I am from Cloud9 Noida. I will be talking briefly about the respiratory problems created by the air pollution. Now, if we were to describe the diseases in children in three different portions, the children less than 1 year, children between 1 to 3 years and more than 3 years. Now, the diseases will be different in all the conditions. Now, children very young are very prone for respiratory conditions. The pollution, not only outdoor but indoor pollution, is also of importance. The most important pollutants the children less than 3 months would face are basically the indoor pollutants. These are the ones who are going to have indoor pollutants, mainly in the form of either some smoke or some smog also. In fact, if somebody is using some fuel, some oils in the kitchen, these days kitchens are actually combined to the rooms, and that's how the oil pollution also comes here. Now, these are the ones who are going to have very common respiratory problems like nasal blocks, coughs, some pharyngitis. That's it. Usually resolves once you take care of these things. Once the child is about 6 months and has started going out, and most of the pollutants actually they harm you in the morning time and in the evening time because of settling down of the particles. So the important advisory for these children would be that they should stay indoors, especially when the cold weather is setting in. One should take the children especially in the afternoon, and should avoid obvious contact with people who have cough and colds and who have other contagious respiratory conditions. These are the ones, children between the age of 6 months to 1 year, they are very prone because of their outside movements. They are very prone for upper respiratory tract infections like pharyngitis, laryngitis, rhinitis, allergies, skin allergies. Even the pollutants can cause skin allergies on the face and the mouth area. Children more than 1 year are also prone for these conditions, but by this time, if there is a hereditary history of allergies in the family, either skin allergies or respiratory allergies, these are the ones they can have more prominent diseases. These are the ones who may have asthmatic conditions, they may have wheezing, viral wheezings, actually precipitated by the pollutants. Now, the common pollutants available are, as we all know, the dust particles, especially size 2.5 mm. They are the ones who can reach into the lungs very deep into, and then can cause chronic disease also. But between the age of 1 to 3 years, they may precipitate the asthma and bronchitis like conditions. Children more than 3 to 5 years are usually, they are the ones they take lots and lots of pollutants, especially coming down from the atmosphere and emanating from the earth. So again, they may have bronchitis, asthma, laryngitis, viral pharyngitis aggravated by the pollutants. Talking about the age group more than 4 to 5 years. Now, these are children who are basically wheezing. What is the cause of wheezing? It can be virus, it can be pollutant. Mainly, there is a combination actually. The virus sensitizes the body and the airways, and the pollutants add to it. Since the pollution level also goes down, the cough usually goes down, the respiratory discomfort also goes down. And again, indoor pollution should not be considered as a small one, because that also contributes to it. Now, there has been too many talks about use of masks during the when the child is going out, and can we use masks, and what are the best masks that we can use. So there is no best mask as such, but whatever mask that you use these days, N95 and N99 masks are coming. They can actually filter out even the smallest of the particles. They can actually reach into the lungs. But the advisory should be, these masks should be used and can be used, but they should be used in such a way that they are very tight onto the face and nose, so that whatever air that you breathe should come from the mask only. They should filter out from the mask and can enter into the airways. Moreover, one should actually replace them regularly, because one should not think we've taken a mask and it can last for days together. Ideally speaking, you should be changing the mask every second day. But sometimes it may be difficult. Some midway can be taken, but ideally it should be changed every day. most of the parents are usually asking for whether we should put a air purifier at home or in the in full building, and is it going to help us? So the advisory in these cases would be children who are very prone for infections, the children who are very prone for allergies, the elderly people who have these kind of respiratory problems, who are prone for respiratory problems from asthmatics, uncontrolled asthmatics, chronic lung diseases. They are the ones who will be benefited by the use of air purifiers. Not only all purifiers, some HEPA purifiers will be better.